Good morning, everybody, and welcome back to the 22nd Annual Family Cafe. Once again, I'm Jeremy Countryman, Program Director here at the Family Cafe, and I have my friend Joe McCann here with me.
Good morning, everybody.
How's it going, Joe?
It's going great, man. How was your long weekend?
My long weekend?
Yeah.
Yes, it was great. We did have that one day off yesterday.
That's
so
right.
allowed everybody out there to reset and get ready for the final week here of our virtual event, which we're excited about. We have 10 sessions planned over the course of the week, 2 per day, of course, at 11 o'clock and 2 o'clock Eastern. And this morning, we're going to be giving you a little bit of information about managing child anxiety and stress around COVID-19. Definitely a very timely topic.
Absolutely.
Yes, don't forget, even though there's a lot of stuff starting to open up, this is something that's going to be around there in our communities, I think, for months to come. And a lot of families, especially when you have children with disabilities or adults with disabilities in your family, can present some extra challenges beyond what a typical family might experience.
Yes, absolutely. Absolutely.
So our presenter this morning from the University of Miami is Jill Ehrenreich-May. This session actually comes to us through our friends in the military community. They went out and made a connection with Jill, and we decided that it made a lot of sense to have her presentation here as part of the virtual event, since this is something I know a lot of people have interest in and need to hear about. Now, if people have questions and comments, how do they go about sharing those,
If
Joe?
you have any questions, please write them in the comment section of the Facebook Live feed that you'll be watching on, and we'll be monitoring those, and we will ask those questions to Dr. Jill in the last few minutes of the presentation.
Absolutely. All right, so with that, I'd like to go ahead and hand it over to Dr. Jill. Welcome.
Thank you. Thank you so much for having me. It's my honor. And as mentioned, I'm going to be speaking to you today about a topic that I've been studying for really most of my career, which is the treatment of childhood anxiety and related concerns. And we're going to talk about management strategies that could be helpful to you and your family as it relates, particularly, obviously, to our current pandemic. As mentioned, I am a professor and the assistant chair of the Department of Psychology here at the University of Miami. And I also direct a research program called the Child and Adolescent Mood and Anxiety Treatment Program, which I'll speak a little bit about right at the end, since we have some telehealth treatment studies that are actually available statewide that may be useful for some of you who may have children or even yourself who may be feeling some stress during COVID-19. So things that I hope to impart to you today, first, just to talk a little bit generally about the impact of COVID on child and family mental health and well-being. Then we'll switch gears and talk a little bit about what we know about childhood anxiety, how it develops, what it looks like when it becomes a clinical concern. And then we'll spend the bulk of our time talking about some evidence-based tips and strategies for managing childhood anxiety and related distress during COVID. And finally, once again, end with some treatment resources here at the University of Miami that may be useful to you and your families. Again, feel free to add your questions, and I'll leave a few minutes at the end to discuss those. So first, just turning our attention to the impact of COVID on child and family mental health. It'll be no surprise to anybody with a child to understand the really widespread worldwide impact of COVID-19 on children and adolescents. If we look across 180 different countries, at least 90% of children in those countries experienced either partial or complete school closure in the last several months. And we know that that has an array of possible educational consequences. There are some children and families who were able to adopt to a digital learning environment, and some for various reasons, age, developmental level, cognitive level, where that might have been a challenge, and limitations may have occurred in regard to educational uptake during that time. We also know that there are many children and families who are experiencing hardships during this time, and for whom food scarcity concerns exist, and school was obviously a place in which, there was provision of food and other services to the children and families as well. So the closure is meaningful. As well, we know that as people have quarantined, their access and availability to interact with other types of providers have also lessened. So we've seen, again, worldwide reductions in rates of youth vaccinations, well child visits, interactions with pediatric providers. And those are also obviously concerning in terms of possible health impact, as well as monitoring of children for things like mental health concerns, as we'll discuss. Of course, the good news is that most people tend to be pretty resilient when faced with adversity. So it's not the case that every child who is experiencing this worldwide phenomenon, is going to have a negative mental health outcome. They may be experiencing distress during this time, but again, the course is for most people to be resilient, most people to recover. And I think that's an important message right here at the start, because obviously we will talk about what to do when things are actually going more awry. Now, if we're going to sort of think about what stressors have been impacting children and adolescents the most here during COVID-19, there are an array of either fear or event-related concerns that we could see, being very common to most youth. So, for example, most youth have expressed concerns or are experiencing concerns related to exposure, just like the rest of us, to COVID-19, fears of infection, fears that family members might become infected or have, hospitalizations or worse outcomes due to COVID. We know children are heavily impacted by physical distancing measures. And again, these are necessary measures. I'm not criticizing them. However, I think it's really important to understand that, because especially at certain developmental levels, the interaction with peers was largely occurring in school settings. That may mean that children are experiencing a lot of social isolation, just like we all are experiencing certain levels of social isolation, and how that can impact, we as adults, our mental health, may be impacted even more for children and adolescents because they may not always have the same virtual means of interactions, or as frequent virtual interactions as maybe we as adults might have, that might help bridge the gap a little bit more. We know that meaningful events have often been canceled, things like graduations, birthdays, and for most of us who are older, we can sort of put that in perspective. But for younger individuals, they may not really have a sense, or they may feel like, well, this was my only graduation, or I'm never going to turn 7 again, and so there's a lot of sadness related to those kind of event cancellations. Many kids who had a lot of physical activity outdoors, sometimes group sports, for example, have really had to rethink or re-understand how to engage in those activities, or maybe have lost skills or, related to those activities over time. And let's face it, anybody who's home with their child knows that there's a certain amount of boredom that is factoring into things right now, that can lead to a lot of frustrations, a lot of irritability, as we'll discuss. Another important theme you're going to hear from me again and again during this talk is really a discussion about how disrupted routines can really impact mental health. And we know that children who are home are not sleeping at the same amount or at the same times as they normally do. We just talked about the fact that activity has been lessened, and of course, nutrition also, may be really off relative to what people were experiencing in their normal routine prior to this. And those kind of things, as well as the boredom, as mentioned, give rise to a lot of frustrations. Kids were frustrated, caregivers were frustrated with homeschooling. We may have to adopt to something or some hybrid approach to that in the future as well. And of course, you're around all of these people in your household so much more of the time. There's going to be irritable interactions with siblings, and irritable interactions with caregivers at a much higher rate. Before I move on and talk about child anxiety, I do want to acknowledge that some families are particularly vulnerable to distress during COVID. There are certain populations that have had a harder time for various practical and other reasons during COVID. So, for example, healthcare workers, other essential workers who've been working throughout, their partners, have known higher rates of distress during this time. Certainly, parents and other individual family members and children children who are experiencing grief due to loss during COVID obviously are particularly vulnerable to distress. There's research from the US Census Bureau that has suggested that low-income families, women, individuals who are single parents may be particularly vulnerable to anxiety and depression during this time. And of course, we know that populations that have previously experienced oppression and health disparities, like certain racial and ethnic minority groups, are just more likely to get COVID or to experience COVID-related consequences. And that is a huge problem because of all of this related mental health distress that can also come with that, in addition to the health disparities that already exist. Certainly, families of children with disabilities or with special needs are going through a very acute time here. So we have to really think about both caregiver and child mental health for these families during this time. As mentioned, the educational consequences, the loss of significant intensive special education services in some cases, the movement of behavioral, speech, physical therapy, other things to telehealth or some level of parent-directed care within the home rather than provided by an external provider is something that caregivers have had to take on top of all of these multiple roles of being a teacher and a parent and a partner and taking care of the house and all of these other financial stressors and things like that during COVID. So this is an incredibly stressful time for those families. And we also see that youth who have high needs for support may be particularly prone to some of the intense behavioral responses that we see from all kids: the tantruming, the crying, the difficulty, because their routines are disrupted as well. And then they're being managed by parents who are actually being asked to take on really excessive new routines also. It was mentioned at the beginning that I came from sort of the military track into this presentation today. So I do want to make mention of military families also as a group that may be experiencing some greater distress. On the one hand, military families were probably the most prepared in a way for a crisis. They are a resilient population who's really used to rapid change. They're used to having to make adaptations in a hurry. But of course, we know that COVID presents many unique challenges to military families, some of whom are having extended separations from loved ones overseas without a clear mission or end date. Travel restrictions that may be applying to them may be very stressful to try to deal with, and causing, a lot of single parent, interactions within the home. And of course, unexpected changes to routines are something that a lot of military families are dealing with at the moment, just like many of us. I do want to make mention of one resource for military families that I won't be talking about more in the presentation today, but I think is fabulous. The Veterans Administration has developed an app called COVID Coach, and that app is available for free for military families. And it's really a wonderful cognitive behavioral intervention oriented, so based on evidence-based principles, app, and can be really useful for helping deal with distress for military families during this time. So now I'm going to switch gears and talk about what we know about youth anxiety just in general, and how it may relate to experiences during COVID. So if we're going to back up a step and think about fear, and fear is an incredibly normative experience. Everybody is born with the ability to feel fear. It is an adaptive and evolved response that we have as humans. So why are we innately able to experience fear? Well, it's because fear is protective. It has a really important function to alert us to when threats are happening around us and to guide us very quickly, oftentimes without even really consulting our brain too much, to get away from something that's distressing, to emit distress about it, or to even fight. That fight or flight response is part of our response to fear very normatively. And if we think about early development, when we are babies, when we are toddlers, everything is unfamiliar, right? We can say a lot of things feel uncertain during COVID, but of course, this is something that we have experienced, writ broad before, in the sense of getting to know a new environment and having to navigate it. So what infants and toddlers do when they are, faced with the multitude of things that are new and different to them, is that they emit distress. They cry, they communicate, they bring a caregiver closer, and the caregiver's role is really important in learning how to navigate fear fear early on, because how your parent or your caregiver responds to your, indications that you're hungry, that you're stressed, that that new person looks really scary, whatever they're doing is giving you information about, is that a real threat? Is that not? And importantly, will you take care of it? Will you help with it until I'm able to do so myself? Because as we develop cognitively within our brains over time, we develop the capacity to start regulating some of these threats more and more and more so on our own. But that helpful, supportive caregiver is really crucial in the beginning, both to identify real versus imagined threats, and also to help navigate us to the understanding that we can regulate because we can feel safe once again in light of a threat that has passed. So briefly, as mentioned, when we think about the developmental course of fear in youth, what we see, not surprisingly, for very young children, is that most of their fears are about safety, or about sort of, the safe caregiver that they have moving away from them, even things that might be physical threats to them. And once again, these are things that are pretty normal and are going to pass as the child develops the cognitive capacity to understand that not every loud noise means something dangerous is about to happen, that my caregiver will come back, that, I can actually handle this large object myself. Again, these are developmentally normal things that help fears diminish over time. As children age, our worries start to become much more imagined and much more represented within our brains over time. And so for preschoolers, that can still look pretty, interesting, because they'll imagine all kinds of dangers, but not necessarily have the resources to understand how realistic those dangers are. So during the preschool years, we hear a lot of fears about sort of imagined consequences or imagined stimuli that are very unusual in nature. So, I'm afraid there's a monster under the bed, or there's a ghost outside, or things like that. Things that you hear from preschoolers because they can't yet understand that those things are actually very, either no, don't exist, or extraordinarily unlikely to exist. And of course, though, around age 6, we actually develop something called metacognition. We start to be able to think about our thoughts, so to speak. And because we can do this, we can start to put things in context a little bit more. And so as children age into the school years, we start to see a lot more realistic fears emerging. So things about social interactions, about school, about performance, about death, things that, we do have to navigate because they are realistic concerns around us. And I do want to acknowledge that fear is just extraordinarily common during childhood and adolescence. When we've given children surveys just to understand how frequently they are experiencing fear, on average, they'll identify something like 5 fears that are feeling clinically, meaning they're sort of interfering to them and they're avoiding them, or that's causing them a lot of distress. And most of those fears will go away. Now, we can all probably identify at least one fear that maybe hasn't gone away. Over time, some people continue to fear heights, for example, or snakes, but those are usually the most kind of prepared or evolutionarily important kinds of fears that often stick around for many of us over a longer period of time. I do want to point out that although fear tends to normatively go down over time, things like worry or worrying about the future tends to be a relatively stable phenomena, meaning that if you're a person who worries a lot, you're probably going to be a person who continues to worry a lot, over time, especially without any intervention itself. And I used to say at this point, when I would show this slide in the past, that there's no real evidence to suggest that anxiety and depression are increasing in youth. That used to be something about 4 or 5 years ago that I could say with confidence. But even pre-COVID, we were seeing different patterns of anxiety and depression start to emerge. And there are longitudinal studies that now seem to support that, especially in the last several years, we've started to see a rise in anxiety and depression, particularly in adolescents and young adults. We've also seen a rise in suicidal ideation and behavior, particularly in that older age group. So there was already something going on that was deviating from the normal path prior to COVID even. where these concerns were becoming greater within our youth. And it's something for us to reflect on, I think, importantly as a society, because as I'll talk about, anxiety and depression are severely undertreated in our population. And that's a problem when these concerns were rising already and are potentiated even more so during COVID. So obviously I'm referencing things that might look like or are more significant clinical concerns for youth. So anxiety becomes more of a problem, is something that maybe requires treatment for a certain percentage of youth when it becomes excessive. Meaning that it's really disproportionate to say what other children, same age, same developmental level are experiencing. It's persistent, which is hard right now because this is already kind of a long quarantine. It's going to be a longer quarantine, right, for many people. So understanding what is normative in terms of a fear or worry persisting may be hard for people right now. But more than a couple of weeks, let's just say, and causing distress. You see them visibly distressed, or they're complaining of distress, or it's disrupting things like sleep, interactions with other people that they can have right now, other normal developmental tasks that we would expect for a child that age. If those things are going on, the child may have an anxiety disorder. Obviously, these things require better assessment in order to make that determination for sure. But the thing we can say is that anxiety really is the common cold, if you will, of mental health disorders. Taken as a group, it is an extremely common set of problems. And lifetime, as many as a quarter of us will have an anxiety-related concern at, again, a clinically significant level at some point during our life. And what we think is that, at least half of children who are referred for mental health concerns or referred for treatment, it is one of their top problems. It may not be the top problem, but it is one of the top problems that the child is experiencing and needs clinical intervention for. So what about during COVID? I said already that rates seem to be rising prior to COVID, especially in older adolescents and young adults. And there seems to be emergent evidence that at least fear and some related symptomatology that is commonly associated with anxiety is rising during this time. So children have been reported to have increases in fears about illness and contagion, as mentioned previously, related symptoms like, again, not sleeping well, having a lot of frustration and concentration difficulties. A lot of research has been done with children in Italy, as well as children in China. And in Italy, there was a sample of about 6,000 children where parents of youth ages 4 to 10 reported that at least 1 in 5 seemed to be demonstrating new fears, not just COVID-related fears, but new fears during this time. And there were attendant mood swings, sleep problems, again, restlessness, and challenges that these children were experiencing at least more days than not. And then about a third of the children in that really large sample expressed fears about the pandemic. And more than half of them, and if you're a parent at home with kids, you probably are like, yes, about half of the children were reported to be more irritable than they had been previously. So for some of those children, they may be experiencing what we could think of as an anxiety disorder. And we don't really know yet what the frequency of different anxiety disorders is going to be relative to COVID. But we know from the Diagnostic and Statistical Manual of Mental Disorders, or the DSM, how we categorize anxiety disorders anyway. And anxiety disorders as a group include things like separation anxiety disorder. That is something that is more than just those fears of drop off. These are kids who worry very persistently, seek a lot of reassurance, are really going to have a lot of difficulty separating from caregivers. And we might anticipate that some of those problems are going to be worse, in the near future, given that children have been with caregivers for so much longer and the fears of contagion that they may have in going back into something like a school setting. Social anxiety is a really interesting phenomena during this time. The kids that we treat, some of of them, this is like their dream come true, to have been away from social stressors in a school environment. And some of them may feel like they're thriving at home, but they're thriving because they're avoiding the things that bother them, which we know unfortunately does not work long term to treat anxiety. If it did, we could all just avoid everything that bothers us and we'd be all good to go. But unfortunately, it doesn't work that way, as I'll talk about in a few moments. An interesting, relatively less common concern that may be also one that we need to keep an eye on during COVID is something like panic attacks. I had an interesting conversation with a family the other day relative to having COVID and having a lot of respiratory symptoms related to COVID, and then later having a lot of fear of having those symptoms again, which is something that we see with individuals who have panic attacks, where they are fearing having those same sensations again in the future and avoiding situations because they're afraid of having those sensations. So that's something for us to keep an eye on, as well as, again, these very particular fears as they might relate to school, or phobic behaviors where children try to avoid certain situations or stimuli. And then finally, we might anticipate that some children may experience a spike in worry during this time, worry about the future. And depending on how that is managed, as people sort of reintegrate, some of those worries may go up and may cause more frequent interference, like sleep difficulties, concentration difficulties, some of the things that are already being reported. Of course, there are many conditions related to anxiety that are worth mentioning. Obsessive compulsive disorder, people have talked a lot about that during this time, that many of these children who had obsessive compulsive concerns related to contamination, how are they faring? Some of them can really separate this contagion from, or this pandemic from, their own worries about contamination. Some of them are doing worse during this time. And of course, we know everybody is at risk for post-traumatic stress. And depending on prior mental health concerns, how resilient they are, what kinds of stressors they're going through right now, this is a concern for really most anybody who is having particular consequences in some of these high-risk family groups in particular. So, I'm making note of all of the potential anxiety related concerns. We're going to turn our attention to treatment here. But the first thing that I need to note to you about treating these concerns is that the biggest problem with anxiety is that people don't notice it. People don't pay attention to it. People write it off as being something that's going to pass, relatively quickly. And that's often because kids who are more anxious tend to be less disruptive. That's not always the case, but many of them do. Some kids who are very worry prone, some of those kids with generalized anxiety concerns, are very resilient. They can be perfectionists, and sometimes that's a good thing for like academic performance, for example. And so there may be a lot of conflict or reluctance that caregivers might have, or children might have, about treating some of those things. And just overall, things that are less observable to you as a caregiver or to teachers are going to be less frequently identified. So it is an internalizing set of problems in a way, and that's a problem for identifying kids for treatment. And we're doing very little to sort of screen and identify some of these kids so that they can get the assistance that they need, and maybe kind of pretending to ourselves that these things are not happening as frequently as they are. And we know, in fact, that they are happening again more and more. So again, when we are screening, when we are trying to identify, when we're thinking about this for our own children, we're wanting to look again at frequency of our fears or worries, or the persistence of them, how distressed the child is. Are we seeing patterns of avoidance and escape beyond what is sort of normative for COVID? In other words, it's normative, obviously, to stay away from other people right now. And how much is this kind of getting in the way for those individuals? So I'm going to turn my attention now to things that we can do to help our children cope during COVID. One of the things that we can do first and foremost is just communicate accurately to children about COVID-related concerns that they might be having, or fears about information that they're receiving. I typically suggest to parents that they share accurate information only, not rumors, not things that they heard, until they know that they're a fact. Sometimes, obviously, the child will bring it to you, in which case you may have to debunk something. You want to present that information in a way that your child can understand. Now, most children can understand, don't put your fingers in your nose, wash your hands, let's wash them this way. Things that are very simple, straightforward messages. They may not be able to understand, depending on their developmental level, what like a viral load is and how long, things live on surfaces, and so on. So keep your messages simple. Keep them appropriate to your child's developmental level. Keep them brief. An interesting thing is that when you over explain something, it often is, it's threat information. It's sort of telling people that this is really something to worry about. So I have to give you like tons and tons and tons of details about it, rather than just keeping it simple. Again, we want to validate if our child brings up a concern that they have. It is normal to feel anxious right now. It is normal to feel stressed. It's maybe normal not to like certain things that are involved with quarantine measures or physical distancing measures or wearing a mask. It's okay to validate that they have an emotion and that emotion is real. Where you can, and I'm going to repeat this again in a couple of minutes, but it's important to model an effective response to your child's anxiety. So if you can say, for example, hey, if you're feeling an emotion, you can say, hey, I'm feeling a little irritated, or I'm feeling a little stressed, so I'm going to take a moment here to pause. I'm a big fan of the mommy timeout. And I'm going to take 5 minutes to just cool down. You can tell them what you're doing. Or I like to take a walk when I'm feeling, stressed. Why don't we take a walk together? Or I like to talk to somebody when I'm feeling down. Maybe we could arrange that for you too. So by sharing helpful coping techniques that work for you, and also your child seeing you actually doing them, not just talking about them, your child may be more likely to repeat such behaviors in the future. We're going to talk about reassurance more in a minute, because certainly children who are very anxious will ask a lot of questions and ask for a lot of reassurance. We really want to keep these communications brief. We want to keep it short and sweet. Hey, like doctors and scientists are really working hard to find solutions to COVID. And most importantly, don't overpromise on safety. You want your children to look at you as a source of accurate information. And it's very normal to just kind of blanket reassure sometimes, oh, it's all going to be fine. Everybody's going to be good. Everybody's going to be healthy. But, we can't guarantee those things right now. And that's very difficult for us to tolerate. But it's an important life skill to learn how to tolerate uncertainty. And so by modeling that that's okay, again, their emotions are okay, tolerating uncertainty is okay, and you're going to help show them how, you're already making good steps toward helping them cope. But of course, some children may need more than that. And we know that there are effective therapies out there for anxiety. Most of those have what we would often refer to as cognitive behavioral therapy components or other behavior therapy components. Those are treatments that are based in the scientific evidence. They have things like randomized trials and other research to support that they work. Most of them are brief. Most of them are skills focused. So it's not that we're not interested in what happened in the past, but it's very present focused. It's focused on what you're doing mostly in the here and now to manage your anxiety and distress. These are treatments that are applicable to children with a variety of skill levels and abilities, but sometimes need personalization or certain adaptations or certain skills repeated in order to meet the needs of various children with various abilities. There are other evidence-based treatments other than psychotherapy. I study psychotherapy, so I'm obviously most aware of it, but obviously there are several medications that work, but probably most particularly for anxiety, selective serotonin reuptake inhibitors, or SSRIs, sort of the Prozacs, if you will, of the world. And what we know is that for both SSRIs as well as cognitive behavior therapy, at least 60% of children appear to respond to brief courses over about 12 weeks of those interventions. And when we combine them, we may get a response from up to 80% of children. That, like, where in the world do we have something that works that well? That's just amazing kind of outcomes. And again, the fact that they're not utilized as often as they need to be for all of these children and adolescents that are out there who might need services is really a big public health concern to my mind. Some of these same strategies and related therapies also work well for related emotional disorder conditions. So they're not just specific to anxiety. They work as well for in different ways for adolescent depression, for pediatric OCD, as well as for anger and aggression in youth. So, what's within these packages of effective therapies? Well, all of them have some focus on identifying emotion, again, noticing what you're experiencing, labeling it accurately. That's a great first step that you can do today with your child. We talk often about how the emotions that we experience, the fear, the anxiety, prompt certain behaviors that feel good in the short term, but actually don't help us cope in the longer term. So avoiding things, escaping, well, now maybe a little bit normative, but over the longer term, actually don't help us deal with the emotional distress that we might experience. And in fact, may double back on us and lead to poor coping over time. There's a C in CBT, and that's the cognitive piece. Most of the cognitive piece focuses on being aware of of what could happen, but also other possibilities for what could happen when one is feeling anxious. Being able to sit with a thought and not necessarily elaborate on it. That's mindful awareness. But probably the bulk of CBT is effective because of opposite actions that we're asking children and families to take relative to their fears. So rather than engaging in some behavior that is avoidant when we feel fear, or escape oriented, or engaging in a compulsion if we're having an obsession, we're asking people to sit with that distress a little bit longer and expose themselves to that situation. Again, presuming that it's not threatening and actually going to hurt you. And eventually, what we know is that we will learn to tolerate that discomfort for longer and longer periods of time. And that in and of itself provides better coping responses and more flexibility. So things like exposure strategies, engaging in activating behaviors, problem solving is all really helpful. For caregivers, we work a lot on some of these same strategies oftentimes, but also very fundamentally on the caregiver responses that are helping the child to manage their strong emotions versus those which often very accidentally end up reinforcing some of their anxiety. So, very well-meaning parents, we talked about it as they were infants, you needing to step in and provide a caregiving response to them. But over time, they should learn to self-regulate and do some of these things themselves, more and more so. But for anxious kids, they often keep pulling and pulling and pulling for those kinds of accommodating responses. So we'll need with many of those caregivers to try to work on doing something differently, doing something opposite as well than what they're being pulled into doing because of their child's emotions and their own. I've already mentioned exposure therapy and how it might work. This is a therapy that is extraordinarily effective and is one of the least used techniques because many people and clinicians too are worried about making somebody feel uncomfortable. A lot of times people don't go to therapy to feel uncomfortable. But in fact, learning to feel uncomfortable, getting used to feeling uncomfortable, getting curious about feeling uncomfortable is actually the thing that is curative of anxiety. And so what we'll do with children and families is really work toward gradually increasing. This is a contamination hierarchy, which obviously you probably wouldn't do all of right now. But what we do is try to go step by step by step by step up into more and more intense things related to one's fears, and understand that, of course, in a safe situation, these things are not going to hurt us. And we learn as we learn that safety, we also learn to tolerate the discomfort that we're feeling in our body and be able to navigate that distress without escaping, without avoiding, without engaging in compulsions, and so on and so forth. So we've been thinking as a field about how these strategies might apply during COVID. My colleague, Kevin Chapman, has made a really wonderful video. I'm going to play it for you right now about how cognitive behavioral strategies can apply during COVID using an acronym he calls Fight COVID. And rather than me speak about it, I thought we would watch his really great discussion of it very briefly here.
Hi, my name is Dr. Kevin Chapman. I'm a licensed clinical psychologist and I'm an anxiety specialist. And I'm also certified by the Academy of Cognitive and Behavioral Therapies. As we all are dealing with COVID-19, coronavirus, and the issues surrounding social distancing, I know that strong emotions are inevitable. It's really important for us to think through how can we use the science of psychology to help us navigate some discomfort that we're all experiencing right now. And I've developed an acronym that will hopefully be helpful for you and a loved one as you navigate this process together. And we call that Fight COVID-19. And FIGHT is an acronym that uses CBT skills to help you manage strong emotions throughout this process. So the F in FIGHT stands for focus on what you can control. There's many elements of COVID-19 that we can't control. There's a great deal of uncertainty associated with it, and anxiety and uncertainty go hand in hand. What we can control is how much media coverage we allow ourselves to watch, how much we talk about it, the things we can do in our immediate environment, and to follow the CDC guidelines as it relates to social distancing. So focusing on what we can control will give us a sense of control, predictability, and it will help us manage anxiety much more effectively. The I in the fight is identify negative thoughts. Certainly, negative thoughts are inevitable right now. We all have them. However, negative thoughts that are catastrophic in nature, that are make a predictive validity that this is going to happen to me, or I know that this won't end anytime soon, those thoughts create intense emotions that are unnecessary in that situation. So when we identify negative thoughts and recognize that those negative thoughts contribute to the maintenance of strong emotions, that's another important skill to take away. The G in the fight is to generate alternative thoughts. What are some more present focused thoughts that I could come up with? What's the evidence that this won't change for me? Are you certain that this will always be the case? So being able to come up with more flexible thoughts, not necessarily positive thoughts, is a very important skill as we're dealing and addressing COVID-19 and the coronavirus. The H is highlighting what we call adaptive behaviors. What are some behaviors that I can engage in right now to help me navigate strong emotions during this time of social distancing? We can use a number of different fitness apps. We can reframe social distancing as physical distancing, and therefore I can still connect with my friends, my family, and my colleagues through Zoom, through Skype, through FaceTime, and I can still engage in exercise plans and regimens and routines with those that I care about. So identifying adaptive behaviors, ways to still exercise, ways to still connect with those that I care about is a very important strategy. And finally, and arguably the most important, the T. Teach someone else to do the same thing. We're all in this fight together. And I think that as we all understand that if we band together and use the same skills and strategies, I think that we'll make it through together. Thank you.
So I just want to say thank you to Kevin Chapman for sharing that video for this presentation. It's available on his website as well. And I think it highlights, especially right there at the end, where caregivers can step in to be useful about managing their own worries during COVID, but also reinforcing these very same strategies with their children and helping to teach them how to manage their emotions. A couple of last tips as it relates to managing child distress during COVID-19. I'm fond of saying time actually does still exist during a pandemic. Some days it doesn't feel like it does. But, keeping to a routine and structure, you've heard it before. This is something that we've shared as parents with each other a lot. But the fact of the matter is, if you're not sleeping on a regular routine, if you're not eating on a regular routine, if you're not, engaging in activity, you are going to feel worse. And your children are going to feel worse. And that is just a universal truth. And so to the degree to which you can take a baby step today toward greater structure, again, those adaptive behaviors that Kevin was talking about, that's going to be useful for both you and your child. One of the things that's interesting that's happening for a lot of families, because we're caregivers pulled in so many different directions right now, is that we're finding that we're either stepping in too much for our kids and kind of doing stuff for them, or just kind of taking away everything and just be like, fine, you're on screens for the day. I may or may not have done that myself. And I think it's important to recognize that, of course, we're all just doing our best, but finding a routine that works in your household and trying to stick with it as many days as you can is really going to be helpful for longer term regulation. if you have 5 minutes today to do something different, one of the best things that you can do is do what we call special time. And this is really just about connecting with your child. And you may be like, I spend lots of time with my child. I'm home with them all the time. But what are you doing during those 5 minutes that's different? You are following your child's lead and engaging in an activity that they want to do. You're turning off your phone. You're turning off the TV. You are just concentrating on them and what they are enjoying. If they want to paint your hand, let them paint your hand. If they want to cook with you, let them cook with you. If they want to make a TikTok video, make a TikTok video, or maybe not TikTok, maybe something else. Let follow their lead, enjoy what they enjoy. And I will tell you that doing this will bounce right back to you in terms of increasing your own positive emotion. I really think there's a certain amount of acceptance of the uncertainty that we have right now, that our children may behave differently during this time. It's important not to catastrophize that one episode of tantrums or crying or talking back, is going to be something that you're going to see forever. We obviously want to be monitoring of these things and make sure we understand when they become more of a clinical concern. But there is a certain amount of understanding that comes in to this as well. We've talked about modeling behaviors that we want to see more of as well, and really being the adult in these situations with our children and trying to show them the way to how to cope more effectively. I've given you a lot of ideas here today about how you can do that. And one good step along the way is just connecting with their emotion. Again, accepting and listening and validating when they have a strong emotion. Now, that doesn't mean that because they showed a strong emotion that anything goes, right? There still need to be limits as well. If you don't have a list of house rules, you can put 2 on the refrigerator right now, as well as clear consequences for them. They should be fair and reasonable consequences, and also what you would do in terms of praise and reinforcement if they meet those expectations. Finally, I have on there, attention is candy. And what do I mean by that? Well, I really think that you, as a parent, your most powerful parenting tool is what you pay attention to. The social attention we provide to our kids is what is going to shape a lot of behavior. And so a good rule of thumb from learning theory is that whatever you pay attention to, expect it to increase, whether that's a behavior you want to see or a behavior you don't want to see. And there's been all kinds of really interesting studies that challenge this notion of like, oh, well, I'm giving my child aversive attention. They can't want more of that. There's studies that suggest that, parents are way more attentive to their child when they engage in a misbehavior than when they do something that they are expected to do or that they otherwise should be praised to do. So you can adjust your attention and think about it like it is candy. It is sugar. They're going to take any form of sugar that you're going to give them. They would certainly like that delicious sugar that involves praise and positive reinforcement and special time, but they'll take the old candy corn if that's all that they've got available to them as well. And that can factor into how you're managing their anxiety. I've mentioned how to manage reassurance already during the course of this talk. For kids who have a lot of clinical anxiety, we see this reassurance cycle with them that ends up happening whereby the reassurance that parents are providing is actually not effective for them at all and may in fact reinforce their anxiety. So some of these kids, when they're really feeling very anxious, they ask a lot of questions. Is this going to be okay? Is this going to be okay? Is this going to be okay? And the parent sort of, kind of finds themselves in this loop of just being like, yes, of course, this is going to be fine. Don't worry about it. Let's go. And the child immediately feels better. Remember, that's short term, I feel better, but also gives them that parent candy of attention. So what the child ends up learning is that one way to feel better and receive meaningful parent time is through that expression of anxiety. But they haven't actually learned how to cope with it. So we really need to break this cycle by, again, focusing on what you can do and helping the child to think about that as opposed to providing this sort of pat reassurance to, like, say, for example, COVID-related distress. So I'm going to finally just talk about a couple of resources that we have here at the University of Miami to help children and families cope with distress during COVID-19. All of these studies, as mentioned earlier, are available statewide to families in Florida. And I'll talk about them in turn very briefly. So this is our website. You can find us very easily on the web at www.miami.edu/child anxiety, or if you just put Miami child anxiety into Google, this will come right up. And we are an entirely research-oriented program. So everybody who works with us is participating in research on effective treatments. And one of the studies that we have available is actually right now for parents. So parents, as we know, and I, haven't talked about it as much during this talk, but I'm scheduled to do another one for Family Cafe where I'm going to talk a lot more about caregiver distress. We know that caregivers, particularly caregivers with prior mental health problems, are particularly vulnerable group during COVID. And so we are providing free treatment for treatment sessions using these same kind of great cognitive behavioral strategies for parents of children ages 6 to 13 who are living in the state of Florida. To qualify, you only need to have mildly elevated anxiety, depression, or traumatic stress symptoms. Your child does not need to have any symptoms. There's no exclusions related to child health or other concerns. And if you're eligible, you get 4 free sessions of group psychotherapy on telehealth at no cost, plus $150 for completing study assessments. And these are available in English and Spanish, as most of our trials are. We also have a study available for free for children who have something called misophonia. Misophonia is fear and avoidance related to certain kinds of noises. This is a study run jointly out of the University of Miami and the University of South Florida. These kids can have other concerns as well, like autism or other anxiety or depression symptoms. They get 10 sessions for no cost if they qualify, and up to $100 for completing study measures. They're randomized to receive either our cognitive behavioral treatment, which is called the Unified Protocol, or to a relaxation therapy, again, provided entirely via telehealth. Finally, if you don't qualify for one of those 2 studies, which are relatively narrow in scope, we always offer a treatment study here at the University of Miami where we're doing an ongoing quality evaluation of our cognitive behavioral approach to anxiety, depression, OCD, PTSD, and related concerns, again, called the Unified Protocol. This is for children ages 5 to 17. This is not free. It's on a sliding scale, but we don't turn away families for cost. It is provided in English or Spanish, and children and families receive some monetary reimbursement for time related to filling out study measures, as well as booster sessions. So those are the things that we have available here at the University of Miami. Hopefully you found some helpful information today, just in general, about how to help your child cope during this difficult time. I try to end these talks by really thinking that, everybody is doing their best during this time. Your children are doing their best, you're doing your best. And, there's always more that we can be doing. But even if you're thinking about just little tiny baby steps toward healthy coping and adaptation for you and your children, you're doing the great thing for your child. And just being here and listening to this is already a great thing that you did. So I really appreciate your time and your attention today. So thank you.
All right. Thanks very much, Jill. That was a very informative presentation.
Yeah,
I feel like I could go back and watch that a second time because it was
get a lot of new
resources and strategies and a lot of really good stuff in there. So thank you for that.
Oh, my pleasure.
We do have a couple questions. I just wanted to ask one that came to me real quick, and I thought it made sense to bring it up now because you're looking at that caregiver information, and you're talking about how that was sort of an issue that you were going to cover a bit more next time. I think this is something I've dealt with, as a parent and having several kids in my house who, obviously are having a hard time dealing with all these transitions. One is getting ready to go to college and doesn't know if that's going to happen or not. So what are some kind of tips or advice you would give to parents who, in terms of sort of maintaining their own sense of positivity and resilience, especially if they have, their own underlying issues when they're trying to support, the wellness of their kids? What's the kind of the most important thing you can do in that regard?
I think there are a lot of things, when you get on an airplane, right? They're giving you the instructions, they always say you have to put on your own air mask, right, before you put on your child's air mask. And I think that, sometimes we have forgotten to continue on the management of our own self-care during this time. And again, that doesn't have to be extensive. It could be like that 5-minute mommy timeout or daddy timeout, right? In order to just take a breather. And again, you can reinforce appropriate coping while you're doing that. You can say, I'm feeling really stressed and irritable and I don't want to yell. So I'm going to quarantine in my room, for this next 5 minutes, or I'm going to take a walk around the block for 5 minutes and I would like to not be disrupted while I cool off, and sometimes just those little things, feeling free to express your emotion and link it to something adaptive for you and not just for what your child is feeling during this time, I think can be very valuable. And I think, again, people are doing so much to try to help and manage their children during this time and then sometimes forgetting about themselves. And yet that is like maybe the number one step, that they need to take in order to be available as more helpful caregivers to our children. So helping yourself, again, we think is very helpful to managing your child's distress.
Right.
Well, again, Jill, thank you. Just a couple of quick questions that we have. Can you talk for a minute about the relationship between worry and fear? And when does one become the other?
Yeah. So worry is a future oriented state. So worry is I feel like there might be some threat coming up. There's a test, there's a evaluation, there might be something bad that's going to happen in the future. And I'm thinking about it and representing it in my mind, but I don't know actually how it's going to happen just yet. Now I may have some experiences in the past that can help me and provide some information about that. I might be able to learn some things from other sources about it, but I don't really know. Fear is a present oriented state. Fear is like in the here and now, I am afraid X is going to happen. And so, we are dealing with a lot of fear on a, somewhat daily basis, which is unusual, right? This is one of the many ways in which this pandemic is unusual. We're just not often faced with this kind of daily reinforcement of threat. And so certainly one can lead to the other, right? If you feel a lot of fear on a daily basis, you might worry about other consequences in the future or other bad things that could happen. And people get kind of stuck catastrophizing and making what end up being, judgments about what could happen in the future that may not be particularly accurate, just based on sort of the fear they're feeling in the moment. So that's one way in which fear can really lead to more excessive anxiety or worry over time.
Fantastic. All right, I think we have time for one more question. And it is this: how do you tell normal fear from something that requires help?
Yeah. So going back to the parameters that I mentioned, we as clinicians, try to do a good job of we don't just give you like a questionnaire that you found online, right? We spend a lot of time thinking about how often is it happening? Is it happening every day? Is it happening, really intensely or persistently, like it's not going away, even though the threat maybe has passed or something is not, present to them anymore. They're still anticipating it as though it is present or it is going to happen. We know that for many kids, they will sometimes know it's more of a problem because they're telling us that it's more of a problem. That's not always a reliable bar, but it is sometimes a reliable bar, and you should at least take it seriously, even if you don't agree that it's that, you want to honor their experience and be like, okay, it sounds like you are saying you're feeling very distressed about this. Sometimes people say that so they can avoid a situation. So you have to kind of balance the two. You can't always let them avoid either every time they say they're distressed. But if that's happening very often, that's obviously a concern. And for me, I'm always most concerned when it's getting in the way of normal development. When kids are not engaging with peers, they're not doing the things that they should be doing in school, or, talking with their teachers, or doing, the kinds of routines that we would expect for somebody their age because of fear. That's probably the number one thing that I look at as potentially interfering with their life.
Fantastic. Dr. Jill, thank you so much. This was hugely helpful. And can you say one more time, what is the website that people should go to for some of these resources?
Absolutely, sure. So I put my email up here, but also you can find us on the web at www.miami.edu/child anxiety.
Excellent.
Right. Thank you so very much for that, all that great information.
We really
you gave us this
appreciate it.
morning.
Thank you.
All right. Well, we have another session coming up at
We
2
do.
o'clock. So let's do a little bit of a preview of that and a couple
Sure.
of housekeeping things before we sign off here. What's happening at 2,
At
Joe?
2 o'clock, our good friends from FAST will be talking about home automation and assistive technology. So please join us for that at 2 o'clock.
Yes, that'll be good. We also want to make sure we mention our sponsors, which include Able United, Career Source Florida, Disability Rights Florida, and Sunshine Health. So thank you to all of them.
Yes.
We also want to remind you once again, you should have received a packet in the mail when you registered, and that included a pink card, which looks like this. You've seen it a million times before, and a report card, which looks like this. Go ahead and fill those out, send them back to us in the mail, and we will get you a free gift while supplies last. The other thing about those that's good to remember is they are both available in our smartphone app as well. So if you've downloaded the app or you have it from last year, still on your phone, just open it up, go to that survey tab, and you can find both the report card and the pink card in there. Just remember to definitely give us your address so we can send you your gift.
Please. Great. We will look forward to it, and we look forward to seeing everybody at 2 o'clock.
Yes, we will see you at 2. Thank you.